Some brief remarks, followed by Dr. Hinshaw.
Good afternoon. I want to be able to touch a couple of points with everyone today. But before I do that, I want to share my condolences with everyone who has lost a family member or a loved one due to COVID-19 over the past 9 months. These are our friends, our children, our parents, our grandparents, and our great-grandparents. And as an Albertan and as a healthcare worker, my heart goes out to everyone impacted by this pandemic. I would also like to take an opportunity to thank everyone who works in our healthcare system. This has been an incredibly difficult and challenging time, and the pandemic continues to put enormous pressure and strain on all of us. I'm beyond proud of how each and every one of you have stepped up and continue to provide quality care to all of our patients, clients, and continuing care residents. You are all heroes. This afternoon, I want to talk about our contingency planning, which includes our mobile medical unit plan, as well as progress being made to increase our contact tracing teams. As part of our contingency planning, we have developed plans to create low acuity inpatient mobile medical units in both Calgary and Edmonton. While there is not a current need, it is clear that Alberta's healthcare system is under significant stress given the increasing numbers of COVID-19 cases in the province, and AHS must prepare for all scenarios. This plan is part of our ongoing, proactive pandemic response planning and is one of several initiatives that will ensure our healthcare system can meet increased demand caused by COVID-19. We are also trying to maintain a balance of continuing to provide non-COVID related care to Albertans. Throughout our response to the COVID-19 pandemic, AHS has proactively planned for all scenarios, ensured we have access to all resources available, both within and external to the organization. Additional beds in a mobile medical unit would be used for low acuity patients or vulnerable populations who need low acuity health care. These may be patients who are stable and on the road to recovery, but aren't quite ready to be discharged home. Having these mobile units would help reduce demand on our in-hospital acute care beds and teams. No formal agreements have been made. However, we are in discussions with several external organizations to identify potential partnerships. Staffing these mobile units will be a challenge, and planning work is underway on potential staffing models. And while promise of a vaccine is a light at the end of the tunnel, staffing remains to be a challenge, and we will continue to look at ways to deploy our staff. For example, in partnership with the College of Physicians and Surgeons of Alberta, we have relaunched the college's COVID-19 physician registry, which enables physicians to enter their current availability to provide care as part of our response to COVID-19, and their willingness to be contacted by AHS for COVID-19 redeployment opportunities if needed. This mirrors a very similar approach that we took in the spring. Provincially, there are approximately 8,800 out of 11,000 physicians who have responded to this request for redeployment. Physician redeployment will be based on service priorities determined through a consistent province-wide approach that reflects the needs of patients in each zone. This will assist AHS's efforts to support temporary staffing changes, which will ensure the availability of physicians in areas of greatest need. We're also working extremely hard to bolster our contact tracing teams. As case numbers have increased exponentially in the past 6 weeks, it has become more and more difficult for our teams to keep up with demand. Added focus has been placed on increasing the number of contact tracers we have provincially. We are rapidly increasing our response to the unprecedented volume of COVID-19 cases in the province. We have continued to enhance our contact tracing teams to meet demand, and we have currently about 50 contact tracers pre-pandemic. We increased this to 5 times by July to 300 and more than doubled it again to September to 700. We now have more than 900 contact tracers in Alberta and are on track to double it once more, bringing us to over 1,800 contact tracers by the end of 2020. This means that we will have 36 contact tracers per 100,000 people, which will be on par or better compared to other provinces. We're also in the process of placing offers onboarding, and scheduling orientation for the 500 additional staff. We are employing rapid hiring of suitable candidates through postings of regulated and non-regulated roles. This contact tracing team will be a mix of part-time and full-time staff, including RNs and LPNs, and other regulated professionals such as occupational therapists, physiotherapists, dental hygienists, speech and language pathologists, and others. And in addition, we have reached out through our volunteer resource database to those who we know are qualified to join the contact tracing team to ask if they are interested in applying. As a result of this outreach, approximately 350 current volunteers have signaled their interest in joining the contact tracing team. We appreciate the overwhelming outreach from many Albertans who want to help with contact tracing and encourage any interested to visit ahs.ca/careers and apply for an open position. Alberta is also expanding our Statistics Canada workforce. Currently, 45 StatsCan employers are supporting AHS, with 30 more to start next week for a total of 75. We are working with our community and industry partners, professional colleges, associations, and post-secondary institutions across the province to help actively promote contact tracing job opportunities with their membership, including past and inactive members. AHS contact tracing postings have been shared with WestJet's Human Resources on Monday. To date, we have hired 7 candidates from WestJet. We have also signed a contract with Ian Martin Group Recruitment Agency, which will see 50 candidates delivered ready to start December the 14th, and another 50 candidates delivered ready to start December 21st. We're also working on 2 additional contracts to be awarded by end of the week to secure contact tracers through third-party employers. We are prepared to meet the changing demands of COVID-19 with our increased numbers of dedicated staff, as well as innovative solutions of web portals, online booking, and SMS text notifications. So thank you for your time today. Thank you to all Albertans for taking the restrictions seriously, because we are all in this together. Thank you.
All right, we will now turn it over to Dr. Deena Hinshaw.
Thank you, Tom. Thank you, Dr. Yiu, and good afternoon, everyone. Before I give today's update, I want to say thank you to the many Albertans who have sent me messages of encouragement this week and have encouraged both me and my team. I am grateful for these notes and for what they represent. Albertans working together, encouraging each other, and standing firmly against COVID-19. Each one of you is making a difference. Thank you. Over the last 24 hours, we have identified 1,828 new cases of COVID-19 in Alberta and completed about 17,200 tests. Our provincial positivity rate has risen to 10.5%, and we now have 18,243 active cases. This positivity rate is a grim milestone and one that should concern us all. There are 533 people in hospital, including 99 who have been admitted to the ICU. Sadly, there were 15 deaths related to COVID-19 reported to us in the past 24 hours. I want to share my deepest condolences with the family and friends of these individuals. Grieving the loss of a loved one is never easy, and I know the challenges and restrictions of this virus make it even more difficult. In schools, there are currently active alerts or outbreaks in 415 schools, about 18% of all schools in Alberta. Currently, they have a combined total of 1,581 active cases. This number includes 221 schools with outbreaks, including 99 currently on the watch list. We are heading into the first weekend of December. In a difficult year, I know this last month may be the toughest for many. This virus can spread quickly from one to many. In a month usually marked by festive gatherings, we feel the restrictions more keenly. But I want to stress the seriousness of the rising case numbers that we are seeing and how crucial it is that we reduce the spread and bend the curve back down. Earlier this week, I was reminded of the remarkable work that many Albertans are doing to support each other in this difficult time. Groups like the YEG Community Response Group in Edmonton and the YYC COVID-19 Volunteers Group in Calgary, both of which have done amazing work using Facebook to help connect people with free food, walkers, and other supplies and resources throughout the pandemic. Or the folks in St. Albert who groomed the walking trails and made the main paths more than 6 feet wide to allow people to pass safely while they're out getting some fresh air and exercise. I've also heard about many initiatives across the province that are connecting generous donors with seniors to provide cards and small gifts during the holidays. A meaningful gesture to remind those who have been most impacted by the pandemic that they matter. Millions of Albertans have risen to the challenge and are working very hard to limit the spread and to support each other. Today, I want to say thank you to everyone who is following the health measures and going above and beyond to prevent the spread. You are the majority in our province. This weekend, we need you to keep doing what you have been doing. If you have not been following the rules, or if you know that your behavior could be a little safer, this is the weekend to change it. This is the time for staying home and staying safe. If you do meet people, meet outdoors if you can, and maintain physical distance. Avoid anywhere with crowds. This includes shopping at less crowded times and using local curbside pickup shopping when you can. These are just a few examples. In fact, I want to issue a challenge to all Albertans this weekend. A challenge to fully embrace not just the specifics of the measures, but also the spirit of them, which is to reduce as many in-person interactions with people outside of your household as possible. Go above and beyond whenever you can, by resisting the urge to socialize this weekend and limiting your close contact with others. You are not only protecting yourself and those closest to you from the virus, but you're playing a critical role in helping to break chains of transmission, which can save lives. By getting outdoors and enjoying the mild weather, you're supporting our dedicated healthcare workers who work around the clock to care for Albertans. By connecting with family and friends virtually, you're helping to prevent spread and protect our healthcare system. By staying home and bending the curve, not the rules, you are sparing someone from the worry of watching a loved one battle COVID-19. You might even spare them the pain and loss of losing someone to the virus. Each of us holds this power. By all of us going above and beyond, by reducing as many in-person interactions with people outside our households as possible, we can harness this collective power. We are all in this together, and the majority of Albertans working together has the power to change this. This weekend, please be wise, be kind, and please go the extra mile. Thank you, and we'll now be happy to take questions.
All right, we'll go to the phone now. Where possible, please direct a question either to Dr. Hinshaw or Dr. Yiu. Operator, could you put through the first caller, please?
Our first question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. This is a two-part question. A number of cases of COVID-19 have been tied to malls in Calgary, including Chinook Mall, but they aren't reporting them publicly. So should businesses like malls be forced to publicly report cases of COVID-19 at their locations? And is there any way for a mall to be run safely given the challenges with managing customer numbers?
With respect to the first question, so first of all, I would say that in media earlier this week, there was a report that there had been some cases identified who had been present at Chinook Mall on Friday. And I know that I spoke about that last week. I said that it's a little early to be able to know if there was transmission events that happened at that time. So the cases that you're referencing, I'm assuming that they're the same cases that were referenced earlier this week. As you likely heard from Alberta Health Services, we do have public reporting of any cases that are linked to an outbreak where there are Depending on the setting, sometimes it's 5 or more, sometimes 10 or more cases. And if there is a setting where it's deemed that there was a significant exposure where we're not able to contact all the people, then in that case, local public health may choose to issue an alert. So again, I'm not aware of all the circumstances of the cases at the mall, and it would be up to local public health to determine whether or not it's necessary to issue an alert for those cases. The question of whether or not malls can operate safely, again, it really is dependent upon whether the restrictions are being followed, if capacity limits are being followed, if individuals are maintaining 2 meters or 6 feet of distance between each other at all times. Ideally, everyone, of course, at this point in time with the restrictions in Calgary and Edmonton would be wearing masks when in those indoor places that are workspaces for many. Those are the kinds of things that can help mitigate the risks. But as I said just a few minutes ago, the absolute safest thing to do this weekend is to consider whether you can go in off hours where there's less crowds, call ahead and consider some kind of a curbside pickup option. And ultimately, again, this is a responsibility of the operators of malls, the operators of retail stores, and the Albertans who attend there collectively to keep these places as safe as possible.
Operator, could you put through the next question, please?
Our next question comes from Jess Slack of 660 News. Your line is open.
Hinshaw, I'm just wondering if you know what the province's R value is right now. I know that that's a key metric in determining whether or not restrictions will be lifted on December 18th. So I was wondering if you just knew that current number.
The R value is calculated once per week, and usually at the beginning of the week, so I don't have a current R value for today. That's something that we're looking at closely, but ultimately the R value is a reflection of the growth, as you know, and we know that the number of new cases has been growing steadily. As you heard today, we're over 1,800 cases. And we also see our positivity rate rising. So while I don't have the specific R for again, next week, that'll be calculated early next week, clearly our cases continue to rise. So clearly our R value is still above 1.
Operator, could you put through the next question, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, this question is for Dr. Yiu, and sort of a two-parter. First off, just wondering what conversations exactly are happening around staffing planning for these mobile units. And then secondly, generally speaking, what is happening with staff redeployment in hospitals to deal with COVID-19? Does that mean there will be fewer staff for patients? And if so, what does that mean for patient care?
Thanks for that question, Julia. I think first and foremost, we always want to ensure that there is quality and safe care in any hospital facility within the province. So that is absolutely always going to be the case. I think what we're trying to do is look at different sort of models of care and try to be a little bit flexible in terms of some of our very, very skilled areas and try to balance that with some of the other types of healthcare providers that we can actually balance them off with. So what do I mean by that? So for example, when we look at certain areas where, for example, in ICU, where we do know that that we have a limited number of sort of ICU type nurses, what we're trying to do with that is that we're trying to expedite some of the training programs. So we've trained, over the past few months, anticipating that challenges may come, that we've been training more of those people that are wanting to sort of up their skills. And also looking at different models of care. And again, as I just want to really emphasize that it is really important for us to make sure that quality and safe care continues. So none of that will ever be jeopardized no matter what happens. But we are very cognizant that workforce challenges are there. So we have obviously expanded our recruitment using recruitment agencies, looking at maximizing overtime, part-time, and obviously redeploying staff that we have doing other works back into the clinical work. So we're really doing everything possible. We do have the advantages of being an integrated healthcare system, so we've got the ability to pull workforce from all over the province. But there's no question that we are continuing our work to make sure that we continue to make sure that we have adequate staffing.
Operator, could you put through the next caller, please?
Our next question comes from Jason Herring of the Calgary Herald. Your line is open.
Good afternoon. I suppose this question is for Dr. Yiu. Contact tracing has been overwhelmed for almost a month now, and we don't know where about 85% of these new cases are coming from. Isn't it a little bit late if going to 1,800 contact tracers is now only going to bring us into line with other jurisdictions? And I guess the second question to add on is, do we have a date for when Alberta's contact tracing system is expected to return to full functionality?
Yeah, I think that we have been progressively increasing our contact tracing hiring. As you have heard, back in the spring, pre-pandemic, we started with 50 people in our CDC team. And so we've been increasing all along. Obviously, with the exponential increase, we're trying to obviously catch up with that. And there's no question that when you don't know necessarily where the contacts are coming from, it becomes much more challenging. And so we're also using other opportunities to make sure that we maximize regulated with unregulated workers and taking advantage of the federal contact tracers who are actually also helping us in the province. So we're doing everything that we can to manage this, but I would say that contact tracing is but one of the means by which we need to make sure that we reduce the spread of COVID, and that is really, really important to adhere to the CMOH orders.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Our next question comes from Rafi Bujikanian of CBC. Your line is open.
Hi, I have, a couple of questions for Dr. Yiu. While we're on the subject of contact tracing, is there any kind of update on whether or not Alberta will become part of the federal contact tracing app, which we still are not? And I was just curious because you mentioned a number of external organizations when speaking about the mobile hospitals, but you didn't name the Red Cross, even though that name's already been out there. Can you confirm that, and can you tell us which other organizations you're talking to?
Yeah, the 2 major organizations that we've spoken with, as you know, one is the Canadian Red Cross. Probably those conversations are the most advanced with the Red Cross. And we're actually also talking with the Red Cross in terms of actually providing some more supports on workforce for our continuing care facilities. And the other group that we have been having conversations with is PHAC. Those are the 2 major groups that we're in discussions with right now. In terms of the other question that you have about the contact tracing, I'm going to pass that over to Dr. Deena Hinshaw.
Thank you, Dr. Yiu. So the question about the contact tracing app is, again, as I've said before, the federal tracing app has a particular functionality as a contact notification app or an exposure notification app, but it's not a contact tracing app. And of course, the AB Trace Together app is one that is more integrated within our own system. And so the choices between the 2, again, each of them has different functionalities, different pros and cons. And the AB Trace Together app is one that our teams are continually working to improve. Some of the issues that were identified earlier this fall with respect to the notifications going back and forth with some iPhones that were using the newer operating system, but our teams are working with the individual who identified those issues to be able to resolve those. And of course, we're always happy to hear opportunities to improve so that we can make sure that the AB Trace Together does have the most functionality that it can. And at this time, that's the one that's widely available in the province. And so I would encourage Albertans to download that AB Trace Together app.
All right, we'll turn to our second last question. Operator, could you please put the next caller through?
Our next question comes from Jesse Weisner of Global TV. Your line is open.
Well, hi, this question is for Dr. Yiu. You outlined the contingency plan for the possible field hospital and mentioned that's one part of several initiatives. Can you map out the top plans happening right now, and have any surgeries or procedures been put on hold in Calgary hospitals recently, or plans for that in the next few days like it has happened in Edmonton?
So when we think about trying to create capacity, the mobile medical units for us is really sort of way down the road. The things that we're really trying to do now is, first of all, making sure we expedite discharges, getting people home as much as we can, transferring people to other locations which may not be as busy. So again, we're using our ability to transfer to other hospitals or to transfer even hospitals to other zones. So that's another area where we're trying to move patients. And we know that it's not been easy, that there's challenges, especially for patients and families. And so we understand the stressors with that. The other thing that we're really trying to work hard on is really trying to mobilize continuing care spaces to actually move seniors who are stable in our acute care settings and have them safely transferred to some of this extra capacity. And the last thing, as you had mentioned, was about ramping down services. We know that in the spring, when we actually ramped down services across the province by 60%, that we were able to create about 500 additional beds. Right now, with the state of what's been happening, it's really fluid. Things change day by day, and decisions are made day by day as to whether we do need to cancel surgeries or delay surgeries. But we know that every cancel surgery means that there's one person who's not getting something that they need medically. And so we are very cognizant that we just want to try to find the balance of making sure that we don't balance surgeries when they don't need to be. So right now in Calgary, we haven't done a lot of cancellations. There has been some at certain sites, but really we're really trying hard to make sure that we catch up. As I said, it's very difficult for the patients who actually get canceled or deferred.
Operator, could you put through our final caller, please?
Our final question comes from Brianna Karsten-Smith. Your line is open.
Hi, this question is for Dr. Hinshaw. Dr. Hinshaw, you spoke at the start sort of about how you've been getting some support from Albertans this week especially. Can you talk us through, I know it's, we've seen it up and down over the last few months, but how is your mental health doing right now? How are you dealing with some of the criticism that's been coming in?
Thank you for the question. That's a kind question to ask. I am incredibly grateful to have a fantastic team that I work with, to have a very supportive family, and to have the opportunity to work for Albertans in this role. It's of course not an easy job, but it's one that I take very seriously, and I thankfully so far have been finding the encouragement and the support from my team, from my family, and from Albertans, as I said, who've reached out to me with those words of encouragement to keep me going. I'm finding my health is able to keep up with the strain at the moment.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.